Guys, how are you doing today? My name is Dr. Adriano Araujo. I'm from Brazil, and welcome back to our channel Invisalign for Doctors. And today we are gonna talk a little bit more about Invisalign, of course, and how efficient is the appliance Invisalign. So I just got a message from Ortho, my office, my assistant when I talk to me, but she can wait because of course we are here in recording this movie. Oops, she's okay. Another doctor say me hi. My assistant say me hi. Okay, let's keep it going. That's what's working when you run your office remotely, so you guys can have some idea and how does it work, because I'm here behind these two screens, and my assistant, the doctors, they are all the time and talk with me, and I have the cameras. Anyways, let's go back to the point in today. And the question is this one over here. We're gonna ask: is Invisalign effective in controlling the orthodontic movement? And yes, of course it is. We know it is. I would like to know how much it is. And so we need a guide actually to when we have a question, actually, if we have a doubt and you want to know one answer that we don't have, the right thing to do actually is not going and call your rep, or you're gonna ask your dad or not. The first thing you're gonna do is, of course, we are gonna show this, and we are gonna go to the literature, and then we are gonna see some papers that has been published about your question, right? So I found that this is like really recent. It was published this year, 2015. It's from Gabriele Rossini from Turin, Italy, and co-workers, of course. And we have a systematic review, and he did a good job because of course he selected he make like a research for like the last 20 years, all the papers that has been published about this topic, and he end up with 11 papers, and from these 11 papers he just tried to do some review about how predictable is the tooth movement with Invisalign. And so I know that you are not used to see so many papers in Invisalign presentations. I guess that we have two reasons for that. The first one, because we don't have so many papers published with Invisalign technique. It's like only a 15 years old, a little bit more technique. And remember one of the videos I did a review. Wait, I wanna you guys, where is here we are. Actually, I forgot where we were. And there is two reasons that we don't see many papers during the Invisalign presentations, wherever you are actually, on the meetings, everything. The first one actually is because we don't have so many papers published about Invisalign. It's like a 15 years old technique. Remember, I did I used the PubMed in one of the other videos, and I type Invisalign orthodontics, and then you have 124 papers. And then I type orthognathic surgery, and then has 3,000 and something. And of course I put Damon orthodontics, and then I found 100 and something too. So that's what happens when we have a kind of new technology. So I'm sure that a lot of people is studying more and more Invisalign. So we'll soon, like with all the other new technology, we're gonna have a lot of more papers published about it. And the other reason that most of the speakers in Invisalign, they are not professors. Some of them, they are even not related to the academic fields or some university. They have a great experience and clinical experiences, and that's what they are doing there. They share the great experience, and that's awesome. So because we can see a lot of different things that can be done with the Invisalign. But in the same ways, like try to make some analogy. If you have a runner and some runner, they can run like 45Ks, a marathon, and some other beginners they can just run 5Ks, and that doesn't mean that one is better than the other. Just the one it's more used with that technology, so he can, or he are used to run every day, so he can run a lot more and faster than the other one. So in the same way, who is right? I would say that there is not right and wrong, or better and worst. The point is we need to have an average. So the average, I would say, he runs 10Ks, for example. And so what's the average or tooth movement with Invisalign? So that's we are talking about today. And let's go back now here for this paper. And of course, I did a summary. Like I said, they end up with 11 papers, and and then have the results. And listen, this is a really important message I'm gonna tell you guys now, because we're gonna show the first results that was this systematic review got it, and that's the partial results, because that's why I recommend you watch this video hasta la final, until the end, até o final desse vídeo, because we're gonna have a different results, not different results, but updated results, and I'm gonna explain why. So I strongly recommend you watch this video until the end, right? That's what's happened when I mix the three languages together. But let's keep going. The results. Anyway, so they show the screening, how the papers, like I said, 11 papers, they have the discussion and all the conclusions. But we can see here, I just make a slide, we can see here like a summary, and so what really happens, and what kind of accuracy he got on this paper. And I just named like the 1 to 5. So the number one, the topic number one you're seeing these slides is the high predictable movement that I would say on this paper. And it's upper molar distalization with a bodily movement on average 1.5 millimeters. So that means that if you distalize 1 molar, you can have a really and high efficient movement hasta 1.5 millimeters. And it's something kind of we know. That's why you can, when you have until 2, 3, we're gonna see we can go further a little bit more to distalize and correct some class 2 malocclusion. So Invisalign has done a great job in this kind of tooth movement. The second one is most predictable, is the anterior intrusion. On effective, let them saying here's effective with 0.72. You probably are thinking, if you work with Invisalign, I think I can get better than that, you know what I mean? But this is, of course, that's the papers, that's a summary that they collected in 11 different papers. So we are gonna, that's why I'm saying on the end, the conclusion, we are gonna have a little bit different, the conclusion that we can see in this paper. And the number 3 will be the posterior buccolingual inclination. It's effective, but the anterior buccolingual inclination is not effective. So we have hard time to control the torque on the incisors, upper and lower on average. The rotation, we know that it's pretty effective, but it's not effective in round teeth. And of course, with the innovations of the attachments, and we can have a lot together. We improve a lot on this kind of movement, the rotations. And of course, the last one is extrusions. It has just 30% accuracy. It's the most difficult movement to control. Listen. So that's the results that we have on this paper. So the articles, they are really important always to give us a guide. So we know actually what's happened with Invisalign. If this paper was published in 2015, I bet was approved in 2013, and they collect papers that has been published until 2012. So that's why you think, but wait a minute, 2012 until almost 2016 we are now, we have a huge improvement with Invisalign. That's true, and that is not collected here. That's why I told you we're gonna have some partial results here. It's really good. It give us some idea how gonna work the Invisalign. Without almost something, I would say, using exclusively Invisalign, you know, without the innovation of G5, G6, I guess G4 too. So the attachments, they were not included. They were included, but not like the optimized attachments. So it's a completely different result, and the efficiency of the appliance today is completely different from what we have ever seen on this paper. Because we have some innovations that of course they haven't been included on the treatments of these cases. So this is a result is based on aligners alone, right? So what is really important is, like I told you before, this is these 11 papers in this review has been published in 2002 and until 2014, and the last innovations have not been used in these studies. So, and here we are. And so how improve our predictability? And come over here, you guys. So how to improve this predictability? I would say it's simple. Here we are. Let me put myself here, and I'm gonna use these. Oops, 4, upper 3. Well, I would say here, I would just make really clear, that's why. Use auxiliaries. So what does it means? I wanna just use this to guys to finish this video. So how can we improve the predictability? Using some accessories, some other different kind of tools, we can have a lot of better results in Invisalign. So that's the final message that I want to give you guys today. So how predictive is the appliance? We are working on that, you know, actually. We are trying to understand better how it works. I say we, I'm saying the community of researchers. And I'm sure that the limits that I show it's a lot better that I showing this on average on these papers before. So we can distalize more, we can intrude more, we can get better results with torque control, and so whatever we have and we haven't seen on these results, we can. It's a lot better. And another question. So if the predictability and the efficiency of the appliance is better, can I treat like a more complex case? Of course. Since you need to include some TEDs, you need to put some cantilevers before or after distalizers, work with a lot of elastics, and of course use and take all the advantages of the attachments. So so like every other technique, you know what I mean? If you have like a tough case to treat, you're not just put braces and wire and kind of, and the self-ligator gonna do everything for you. Of course not. You're gonna use different tools to get there. So here's in the same way. Okay. So I guess I was a pretty good message that here we are. Wait a minute. and let's keep in touch here. You know, that it's a great way to teach orthodontics for you guys, and I'm sure that I'm gonna keep doing this like once a week, or once every 2 weeks. We're gonna share some ideas, most of the time in English, but sometimes, of course, will be in Spanish and in Portuguese. And some fellas also ask why you're doing that. Actually, I see like with the depending on the how you teach orthodontists have been changed a lot in the last like 10 years. So an Invisalign improved really fast. So we have so advanced people doing a great job with the appliance, and a lot of people they are on the beginning. So we have a huge gap between these two crowds, I would say. So I'm trying to put together or make like a bridge between the people is starting and also the people that have some experience. So that's why we have this channel, and of course we're gonna talk here not just about Invisalign, but everything that we have the most advanced in orthodontics. And thank you very much for your attention. And if you like, you can share this for all your friends. And if you actually even a question, you can just put on the YouTube. You can make like a question, and then it can be whatever your language. I would prefer in English, Spanish, or Portuguese. And see you guys really soon. Thank you. My name is Dr. Adriano Araujo.